A lot of women have uterine fibroids at some point of time in their life. You may have even had them and never known it. That's because they often don't cause any pain or symptoms. So, if you can get them and not have side effects, how would you even know if you have them? And should you be concerned? To know all about fibroids, we have with us today Dr. Meenakshi Sundaram, consultant gynecologist, laparoscopic and robotic surgeon at Apollo Women's Hospital, Chennai. Good evening, doctor.
Very good evening and hello viewers.
What are fibroids?
Okay, fibroids are basically non-cancerous tumors or benign tumors which arise from the womb or the uterus. Now this incidence generally is about 25%, which means 1 in 4 women can get fibroids, especially in the reproductive age group. So anywhere between 18 years to 40 years, the incidence of fibroids are higher. Now, these fibroids can be either in the outside wall of the uterus, or it can be within the wall of the uterus, or on the inside of the uterus. Now, based on where these fibroids are located, they can cause symptoms and troubles accordingly.
So, what are the symptoms of fibroids?
So normally most of these fibroids are asymptomatic because they're very common. They are sometimes small and they do not cause symptoms unless they are detected on your routine ultrasound. When you go for a checkup, they can be picked up. But fibroids which are symptomatic, that is those that cause symptoms, the commonest one being bleeding. So women who experience heavy menstrual flow, excessive flow during periods, that means normally let's say if you've been using about 3 or 4 pads per day, if it becomes 5 or 6, or if it is associated with excessive clotting, you identify that the bleeding is excess and then you should definitely see a doctor to see whether you have fibroids. So that's one of the commonest symptoms. Second thing is pain. Some of these fibroids which are located very close to the fallopian tubes can cause severe pain during periods time. Even if they are small, they can cause severe pain. The other thing is as the fibroid keeps increasing in size, you can sometimes feel that heaviness in your tummy, and some of patients can even feel the fibroids. And these in turn, over a period of time, as they grow large, they can press on the urinary bladder, cause urinary symptoms. You can have an urgency to go to the bathroom, or sometimes you may not be able to pass completely. Sometimes it can cause constipation symptoms when this fibroid causes pressure effect on the rectum. So it's very important because as the fibroids keep increasing in size, the sheer weight of the fibroid or the mass of the fibroid can press on the adjacent structures.
You mentioned about regular investigation or routine investigations. Are they the only method through which you can detect fibroids?
Yeah, first thing is clinical examination. So when a patient walks into our OPD and we examine the patients, most of the time the fibroid can be picked up on a clinical examination itself. If they are very small, then it can be difficult to detect on a clinical examination. The next investigation we normally offer is an ultrasound. An ultrasound can be done either transabdominally or transvaginally, depending on whether the patient is married or unmarried. And most of these ultrasounds would be able to pick up the fibroid. Now you have also 3-dimensional ultrasounds, which will be able to localize the fibroid exactly. Like I said, whether it's on the outside, the wall, or on the inside of the fibroid. So we exactly know what is the size of the fibroid and its location, and also the nature of the fibroid. The next advanced investigation, suppose you have multiple fibroids and you actually want to map them correctly for a plan for your surgery, then MRI is indicated. So when you do an MRI, it gives you a clear picture about how many fibroids are there, where exactly are they located with respect to the wall of the uterus or the lining of the uterus, and also whether these fibroids have undergone any kind of changes, because some of these long-standing fibroids can undergo what is called degeneration. So these can be picked up better in an MRI compared to an ultrasound.
Are fibroids and cysts the same, doctor?
See, basically when we say cyst, it means it's like a fluid-filled tumor, and commonly cysts arise from the ovaries. And fibroids are tumors which arise from the wall of the uterus. It's from the muscle wall of the uterus. So generally when I say cyst, or when a cyst is given, I assume that it is from the ovary. It is normally from the ovary, and a fibroid is something that arises from the uterus. Of course, you have situations where you can have small cysts in the uterus also, and sometimes fibroid in the ovary also, but these are rare. By and large, a cyst means something that arises from the ovary, and a fibroid arises from the uterus.
We've got a lot of questions from our viewers asking about the impact of fibroids on pregnancy. Can you elaborate on that, doctor?
Yeah, I think in many women, one of probably the commonest time you detect a fibroid is when they actually come for an investigation to conceive, right? When women come with any kind of infertility issues and we do an ultrasound, a fibroid can be picked up. Now, how does fibroid really affect pregnancy? One, if the fibroid is very close to the fallopian tube and it is blocking the fallopian tube, yes, it can interfere with pregnancy. The other thing is fibroids which are on the inner lining. So these are the most notorious fibroids. Even if they are small, they can definitely interfere with pregnancy because they occupy the uterine lining. So the cavity or the womb's cavity where the baby is going to be there are occupied by these fibroids. So these women can have difficulty in conceiving because the baby and the placenta is not able to properly form in the lining, or sometimes that they can have abortions. They may conceive, but then they have an early abortion again because of the same thing, that the implantation of the placenta is not proper. So that way it can interfere with pregnancy. And you see, fibroids which are on the outside of the uterus do not generally interfere with pregnancy unless they are very large, and they can affect the distension of the uterus during the pregnancy, or it can interfere with the delivery patterns during pregnancy. It can change the position of the baby because of the size of the fibroid. But as far as conceiving, it's usually the submucous fibroids that actually can create trouble. And when these fibroids are detected, you'll have to differentiate whether they need treatment or they don't need treatment for the same.
Hello, doctor. I have irregular periods, but my ultrasound scan is normal. All blood reports are normal. Doctor said you just have PCOS type, but your blood tests are normal and you do regular exercise, but irregular periods is a constant issue. And what's the cure, doctor, for this?
Yeah, I think polycystic ovaries or irregular cycles is quite on the rise in most of the adolescent population that we see. One major cause is obesity. Obesity and polycystic ovaries are interlinked. So when patients become obese or rapidly gain weight, the periods tend to become irregular. And again, if the periods are irregular, they tend to gain weight. So these are kind of interlinked. That's why one of the commonest advice we give for patients with polycystic ovaries or irregular cycle is to lose weight, because losing weight itself can dramatically improve the periods pattern because it causes certain hormonal changes that helps in regularizing the cycle. Apart from that, there are hormones which can regularize the polycystic ovarian condition, and I'm sure that the doctor, whoever is consulting you, would be able to advise you on the same.
I have a 3.7 centimeter fibroid. I suffer from heavy bleeding. My hemoglobin is 7.5. My doctor has given me capsule Otrin and Dufiston 10, but I'm suffering from bloating and gas. Can I take any medicine for that? Can I take Dexorin syrup along with Dufiston on the same day, because I think it suits my body?
All right. Now, two things. One, you have a fibroid, and second thing, your hemoglobin is low. So probably the fibroid is the reason for your hemoglobin to be low if you have excessive bleeding. Now, first, we have to detect where the fibroid is. Now, if this is a submucous fibroid, that is a fibroid which is on the inner lining of the uterus, then that needs to be removed, because whatever medication you take, again, when you have excessive bleeding, the hemoglobin is going to fall down. If it is anywhere on the outside or in the wall of the uterus that doesn't require surgery at the moment, then whatever your doctor has given you, the Otrin and Dufiston will take care, because Otrin per se is just to improve your hemoglobin. So you said you are happy taking Dexorange. You can substitute Dexorange instead of Otrin because they are just iron preparations. If Dexorange suits you better, I think go ahead taking the Dexorange. And Dufiston helps in controlling your flow. So most important thing is you need to have a frequent ultrasound follow-up to see if this fibroid is increasing in size, or it is in the lining of the uterus that is continuously troubling you and causing heavy bleeding, then you should consider surgical option.
Speaking of surgical options, is surgery the only solution to remove fibroids?
No. Basically, not all fibroids require removal. Asymptomatic fibroids that are small in size, that are really not interfering with the periods pattern or with pregnancy or anything, can just be left alone. Most of the time, you just need a follow-up to see whether these fibroids are growing, and they don't need any treatment. Fibroids which are symptomatic, especially when you have like a big fibroid, heavy bleeding, your hemoglobin is low, or you're looking at pregnancy and it is interfering with pregnancy pattern, definitely require treatment. Now, there are various modalities with which fibroids can be treated. One is the traditional method is an open myomectomy. The surgical treatment of fibroid is called myomectomy, and myomectomy can be done either by open method or it can be done by keyhole method. Uh, Earlier, like, open surgery was much more common because of the blood loss associated with the fibroid removal. But now, with all the advanced techniques, laparoscopy is an excellent option for removal of the fibroids. Through small keyhole incisions, these fibroids can be removed. The blood loss can be drastically reduced, and also the return to your normal activity is much quicker. The pain is considerably less. The need for antibiotics, anti-inflammatory is very less when you undergo keyhole surgeries. And also, if when you see conceiving and delivery, none of these have issues when you have undergone minimal access surgery. You can follow that up with your doctor. And the latest other modality that is available is robotic surgery. So depending on your fibroid, the nature of the fibroid, the size of the fibroid, what surgical treatment suits you best would be discussed. And also sometimes when you have fibroids on the inner lining, that is the submucous fibroid, they can be removed from below itself by a procedure called hysteroscopic myomectomy. So this is a procedure from below where you don't have to really cut open the belly. You can do it from below if the fibroids are really small. So these would be assessed based on various things like where the fibroid is located, what is the size of the fibroid, and what are your other symptoms in terms of bleeding or hemoglobin as such.
And can large fibroids be removed laparoscopically?
Yes, large fibroids can definitely be removed laparoscopically. I think what is important is that you need to identify the location of the fibroid. Most of these large fibroids, if you have planned the surgery well, can comfortably removed by laparoscopy. And now we have the in-bag morcellation techniques, whereby once the fibroid is removed, you put it into a bag, and then you have a machine called morcellator, which goes in through these small keyhole incisions, and it is easy to retrieve the fibroids, even if it is large.
I have one fibroid in my uterus which has been diagnosed recently. Doctor has advised for an immediate surgery. I want to know if I can wait for a few more months.
Well, fibroids, keep growing with time. Uh, how long you want to wait, I'm not sure. But if it is only going to be a short time, like suppose you just want to finish your, kids' exams, or you want to just finish a function and then get the surgery done, it is absolutely fine. Now, how urgent the surgery is or not would be decided. I think a doctor would be best to decide that, because it would also be based on what are the symptoms you're having, your hemoglobin and all. But if it is just going to be a span of a few days or a few weeks, I think you can wait and get it done.
I used to have period cramps sometimes, which is unbearable. Do I have fibroids? Is it normal?
See, periods cramps can be because of many reasons. One of the reason could be fibroid, but even sometimes without fibroids, a normal uterus also, because of a lot of hormonal changes, can a lot of people have what is called as dysmenorrhea or cramps during periods. So the best way to find is, once you get an examination done, your doctor will be able to find out clinically whether the uterus size is bigger or if there is any fibroid, or get an ultrasound done to know whether you have fibroids or not.
I was diagnosed with multiple fibroids which pose no threat to my health according to my doctor. Is it okay or should I have a second opinion about it?
Like I said, a lot of fibroids can be asymptomatic. If the multiple fibroids are really small, and if they're not interfering with your day-to-day life in terms of excessive bleeding or your pregnancy part or whatever, they can be left alone. You just need to have a follow-up do an ultrasound and see whether these fibroids are growing in size. And if they're just about static and you don't have any symptoms with it, it is absolutely fine to leave them alone.
My wife, aged 35, her fibroid was removed 4 years back. Now she's again got fibroids. What can I do?
Yeah, the other thing about fibroids is there can be recurrence. So the misconception is where we have removed whether the fibroid comes at the same point. It's every fibroid arises from one single cell from the uterus. So what we have removed, the fibroid does not come from that particular region. But remember, the uterus as such has multiple cells. So the fibroid can come from any other cell as well. So till the age of menopause, the possibility of getting new fibroids still exists. So this is totally a hormonal effect. So it does not really mean recurrence, but there is a tendency that if you have a fibroid removed, there is a possibility that you may get another fibroid later, which can be from a different cell. So that is possible.
And what is the option? I mean, should she go for a surgery? Or...
No, again, well, it depends on the size of the fibroid. If it is small and if it's not really bothering, you can just wait it out for a long period of time and just leave it at that. The only way to finally get rid of them is to do a hysterectomy, whereby you remove the uterus with the fibroids, so you don't have new fibroids coming in. But generally, if they are asymptomatic, they are not causing any trouble, it's absolutely fine to leave the recurrent fibroids also alone, unless it requires treatment.
What are the options for large uterus fibroids, doctor?
Yeah, large uterus fibroids again depends on the size and the location of the fibroid. Most of these fibroids can be removed, like I said, through keyhole incisions. By laparoscopy, all these fibroids can be removed. But there could be indications whereby the fibroids are abnormally large or they can cause excessive bleeding during surgery. So it depends totally on the discretion of the surgeon and their ability to do the surgery, that even an open surgery is quite possible in these cases if the fibroids are really large.
Are they life-threatening, doctor?
See, fibroids, as I said, are basically non-cancerous tumors. So in terms of it getting cancerous, the chances are very, very less. 1 in thousands, the changes can be cancerous. It is not a life-threatening disease, but it can just compromise on the quality of life if it causes heavy bleeding or low hemoglobin. So that way it can be a disturbance, but fibroids as such are not life-threatening.
My wife has developed a fibroid which is of size 10 centimeters. Can it be shrinked by taking medicines? She is 50 and still menstruating.
All right. Now, the size of the fibroid that you have mentioned is quite large. Now, usually these fibroids do not drastically reduce with medications. Medications are usually given. Sometimes you can give hormones to control the growth of the fibroids, or sometimes when the patient has excessive bleeding, you can correct those symptoms with these medications. But a fibroid as large as what you've mentioned may not necessarily disappear or shrink to a large extent with medications alone. But the other factor that you were talking about is her menopause. Generally, fibroids start shrinking in size after menopause because the effect of the estrogen hormone is lost after the menopause. So fibroids tend to shrink. So if she's completely asymptomatic and she's attained menopause and she's continuing not to have any symptoms, yes, you can leave it alone. Just keep a follow-up just to ensure there are no other degenerative changes in that fibroid. Otherwise, it can be left alone.
What are my chances of pregnancy after laparoscopic surgery for fibroids?
Usually, we tell the patients to start trying for pregnancy for about 3 to 4 months after the fibroid surgery is done. This is the typical time that the myometrium takes to heal. So, the uterus lining, the wall of the uterus that we have opened to get the fibroid out, takes about 3 to 4 months to heal completely for it to be able to expand and stretch during pregnancy. So after 3 or 4 months of the surgery, definitely patients can try for pregnancy. And we've got a lot of patients after the laparoscopic myomectomies who have conceived, come back to us for delivery, and they have taken their babies home.
What happens to fibroids after menopause, doctor?
Fibroids are hormonal based tumors. Like fibroids grow with estrogens as a predominant factor. So after menopause, once the estrogen is cut off, fibroids start shrinking. So there definitely is a reduction in the size of the tumors after menopause.
I have multiple cysts and fibroids in my uterus. Is it possible that I have any chance of pregnancy?
Well, if these fibroids, like I said, are not really interfering with your uterine inner lining, they are not submucosal, they are just small fibroids on the outer lining of the uterus. Yes, you can conceive with these fibroids also, there is no issue. Again, these cysts, if they are just polycystic ovaries and if you're trying and your periods are regular, you can definitely conceive with them as well. I think most important is whether these are kind of fibroids that are interfering with pregnancy. A good sonography and your doctor would be able to tell you whether these are the cause for would cause any difficulty in your conception, or whether you can conceive with these fibroids. So there is no issues with that.
Hello, doctor. I have heavy bleeding and prolonged periods due to fibroids. Please tell me the cure.
Yeah, if the bleeding is prolonged and it is heavy, you basically need an examination and ultrasound to detect whether you have fibroids, how big is the fibroid, and where the fibroid is located. If it is a small fibroid, we can treat your bleeding issue symptomatically by giving you some medications. We can improve your hemoglobin by giving you some iron supplements as well. But if the fibroid is large, or like I said, it's on the inner lining of the uterus, then you need surgical treatment for the same. Uh, Sometimes the small fibroids, we can put the patient temporarily on some hormonal pills for some time to control the growth of the fibroid. But if the fibroid is large and they are definitely symptomatic, they need surgical removal.
Do uterine fibroids go away naturally?
They don't disappear, but yes, they can shrink post menopause. Or with some kind of hormonal treatment, there can be a slight reduction in the size of the tumor. So, anything that is anti estrogenic or against the estrogens can reduce. So, typically after menopause, the fibroids tend to shrink, but they do not like vanish or disappear magically.
Hello, doctor. I'm 24 weeks pregnant. My scan shows an increase in fibroid size. I also have a fungal subserosa fibroid on the left. Doctor has put me on medicines. I have immense, very bad low abdomen pain. Will it settle eventually?
Yes, see, the subserosal fibroid, which is on the outer side, should not interfere much with your pregnancy or the growth of your baby. You're already 24 weeks pregnant. I think just go ahead with your pregnancy. The little pain that you're having with symptomatic treatment will definitely subside. You don't have to worry about it. Um, you just consult your doctor and just ensure that the growth of the baby is fine.
Hello, doctor. Do you think using sanitary pads can be one of the reasons for uterus related problems?
No, not really. I think most women can't do without it. So, yeah, the hygiene and the cleanliness while using the sanitary pads are very important. Otherwise, you can catch some vaginal infection, but that's all about the personal hygiene of the person as such.
Hello, doctor. I'm a married woman trying for a child. I've been recently diagnosed with intramural fibroids in the uterus, which is pressing the cavity. The size is 1.98 into 2 centimeters. What is the best treatment, do you think?
See, the size of the fibroid, as I can see from your report, is very small. If it is not causing any symptom and if your lining on scan does not show any indentation of this fibroid, I think you can just ignore it for the time being, try for pregnancy. If at any point of time they say that your fibroid is actually inside the lining and you do have symptoms like heavy bleeding, just take it out and then try for pregnancy.
Hello, doctor. I'm 34 years old female, and early this month I was diagnosed with intramural fibroids, but I still have vaginal itching just before my period starts. Is this because of the fibroids? Should I do something about it?
See, the commonest cause of vaginal itching is vaginal infection. So, this could be basically a fungal infection which can be treated. This has got no relation to your fibroid as such. Sometimes, when you have fibroid in the lining, inner lining of the uterus, that can cause excessive discharge. But what you're typically saying looks more like a fungal infection because it is associated with vaginal itching. So I think just get treated for the fungal infection and you should be fine.
I have PCOD for the last 2 years and detected with the fibroid outer side of my uterus. Now I'm facing a problem in conceiving. Please suggest what should I do and help me conceive.
All right. Now, again, with respect to your fibroid, you have mentioned that your fibroid is on the outer side of the uterus. Generally, a fibroid on the outer side should not interfere much with pregnancy, but you probably need an evaluation to see if there is any other reason for not conceiving, that you're trying for pregnancy. The husband factor also needs to be checked. Your tubes need to be checked. If all the other factors are normal, then you can go ahead trying for the pregnancy. And if you're still not conceiving with all these put together, then you can consider removal of the fibroid if it is large.
I have fibroids for the last 3 years. I'm aged 51. I have recurrent bleeding problem. Would you suggest removing the uterus?
At 51, normally I would expect that your periods should have stopped. But if you're still continuing your periods, then we need to see again the size of the fibroid and whether this fibroid is the cause for the excessive bleeding. If you're having recurrent episodes of this bleeding, and also check your hormone levels to see whether you're close to menopause or not. If you're close to menopause, you can wait it out for some time to see whether the periods stop, then the fibroid starts regressing by itself. But if you're not really at the menopausal level and you still keep continuing to bleed, you can go ahead with surgery.
I am 28-year-old female from Dhaka. I have fibroid in the uterus of size 6 centimeters and thickness 5 millimeters. Is it safe to go ahead or to even think of conceiving now?
Now, this 6 centimeter fibroid is big, it's not very large, but it again depends on where the fibroid is. If it's on the outer side, you can go ahead with conceiving. But if the fibroid is going to be on the inner lining or in the wall of the uterus, then you can consider removing this fibroid and then wait it out for 3 or 4 months and then plan for pregnancy.
I have submuscular fibroids and in the prior interior wall. What is the effect of this on me conceiving?
Yeah, submucous fibroids, like I told you, are those which are on the inner lining of the fibroids. These are the most notorious ones. Even if they are small, they can definitely interfere with your pregnancy. So anybody who's trying and has a submucous fibroid, I would recommend removal. This can be done even hysteroscopically. There's a telescope you put inside the vagina, and then the fibroid can be removed. So again, it depends on the size of the fibroid, but a submucous fibroid generally requires treatment. So go ahead removing the fibroid before conceiving.
Hello, doctor. Is there any correlation between uterus fibroid and breast fibroid?
Yeah, see, sometimes a lot of patients who have uterine fibroids also have fibroadenomas in the breast. Again, this is hormone related basically. Now, not all patients with fibroid get fibroadenomas. They can be dissociated also. But still, there is an increased chances mainly because of the estrogen influence or the hormone influence, the tendency for having these fibroadenomas, what they are called in the breast tissue, is possible.
Hello, doctor. I'm 31-year-old unmarried girl. I have a fibroid of 3.5 centimeter in the interior wall of the uterus. I'm suffering from heavy menstruation and pain during bleeding. What is the best option? Is it surgery or medicine?
A 3.5 centimeter fibroid on the inner lining of the uterus with you having heavy bleeding is a definite indication for surgery. Just go ahead with surgery, get the fibroid removed, and probably go on some iron supplementation to improve your hemoglobin. You'll be fine.
I'm a 34-year-old female from Chennai, and I don't know why, but I have my periods twice a month for the last 3 months, and it has never happened before. Should I go for a scan to figure out what's wrong?
Yeah, I think if you have irregular cycles which you've not been having before, then I think you should consult your gynecologist, get checked why this has happened. This could just be a hormonal related instance also, but it is good to have a checkup and get a scan done. to rule out any possibilities of any tumors in the uterus or cysts in the ovaries, which is causing your irregular cycles.
What would be your key message to our viewers today, Doctor?
I think women's health is most important. You need to do your daily activities much more comfortably, and sometimes having heavy bleeding periods and painful periods can be debilitating to most women, especially when you're having a busy and heavy life schedule. I think regular checkup with your gynecologist, get a pap smear done at least once in 3 years, get an ultrasound screen done to know if you have any lesions in the uterus or in the ovaries, and get treated early so that you can have a comfortable life. And if you have any problem, opt for minimal access surgery. It will help you return to your early activities well.
Thank you very much for a wonderful, informative session, Doctor.
Thank you so much, and thank you so much for being with me today.
For appointments with Dr. Meenakshi Sundaram, you may reach out to us at 9600079058. I repeat, 9600079058. Thank you, Doctor.
Thank you.
Thank you, viewers.